I think it's really unlikely that someone in her position it wouldn't be a constant project to maintain her appearance, because if you think about what's going on in show business, like that is your core thing that you do. You've got to maintain your appearance. So the idea that she would get to age 50, look as good as she does, and for that to be purely genetic is really unlikely. I'm pretty sure that she would have had many little interventions, all the way ranging from makeup, really good makeup, all the way through to interventions would be highly likely. So everyone ages differently, and you age differently according to all sorts of factors. So you can age worse because of your skeletal structure. So if you, for example, if you lose calcium, you might lose some of the underlying structure of your face a bit sooner. So that's more common in women, to have bone thinning once you're over menopause. And that can change the structure of your face, but also diet and the amount of vitamin D you might have had in your life might have affected that as well. Then you've got, on top of that, the fat pads, and they all change differently. But the interaction between the fat pads and the bone is also interesting, because, for example, if you have a very small recessed chin and this fat pad changes, it makes a big difference to how you look. Whereas Jennifer's always had a really good chin, and that's one way that people age better, is if you just so happen to have a stronger chin, it makes any changes in the fat pads here less likely to be visible. So she could have been blessed genetically, having good underlying structure, good proportions, which she definitely has been blessed with. But then aging better, partly because of health and wealth that goes with that. If she's maintained her health, and if she's maintained her health, that's one of the things that will show on your skin. I think having a little bit of pigment in your skin does protect you from damage from UV light, but she's probably been aware of that as well. So if she's not someone who's gone out specifically to tan, which is unlikely, then she'll also have the benefit of much less wear and tear than people who go out to try and maintain a darker skin color. The other really interesting thing about aging is stress hormones are a really big aging factor. And the higher you are in the social hierarchy, and obviously she's right at the top, the less sensitive she'll be to negative emotion, the less stress hormones are produced, because she's basically in more control. This is one of the benefits of wealth over a certain amount, is if she feels in control, she has less stress hormones, and that shows less on your face. It's certainly something you see on very stressed people. They tend to basically, unfortunately, show it more on their face. So stress can show on your face, and I'm not saying she hasn't had a stressed life, because everyone has stresses, but it could be at a different level that might overall have produced less cortisol, which might have caused less aging in her face.
I think a lot of people are going to disagree with what you said, because she's a mother, she gives concerts, she travels all over the world, and she has to keep up this persona. So some people might say that she's actually more stressed than some people.
Yeah, I mean, the debate would be that she's in control of those factors, mm-hmm. and she's got huge resources to solve her screaming children. Whereas if you live on a council estate and you've got 5 kids and you've got no money, like you're worried about. You're sitting at home, maybe not doing as much as her, but worrying about how you're going to pay for your kids' next school dinner. Like, it's a different kind of stress because you're out of control of it.
Okay.
So control is the key thing. And not to say she's not stressed, but she's like, there's a problem, solve it. I'm stressed again, solve that problem. I've got to go on this world tour. That's stressful, but I know I can tell people what to do all the way along. Obviously, I can't know for sure what she's had done. There are various aspects of her face that are being maintained so well, and I know how to do it with dermal filler in particular, that it makes me feel fairly certain that something's being done. One example I can use is her chin, because I always say that the chin's almost like the cherry on the bottom. Like, it should be the lowest point of your face, and it should be narrow as a female. And if you look at her chin over the years, it's unbelievably stable and still very petite and feminine and youthful. It's the chin of a 20-year-old, but that doesn't normally happen when you're 50. You normally lose the bottom of it, and it would normally start to rotate up, and you become squarer as your jowl comes down and becomes fuller. So that's dead easy to do with a dermal filler. It would be unlikely, I think. Well, it's so clear to me how you would do that I almost can't imagine it's not being done. But I don't know for sure, but it does look like the kind of contoured chin that someone's done on purpose. The other thing is possible, and I don't know for sure, but if you look at her chin when she was 20, it's very, very narrow. Tapers off right to a fine point almost. And then in most of her pictures, it's similar, and occasionally you see one where it's rounded off, and that's the kind of thing you might achieve with a treatment, which is that you refocus the chin and make sure that it stays as it was in youth. But obviously that changes over time. It will soften, any product will soften, and then you could end up with it becoming slightly rounder, slightly wider, and then that could be restored with another treatment. So there are a couple of pictures that look a little bit like that might be what's going on, but it's very subtle. But yeah, I think that's possible. It definitely helps if you maintain things. So if you've got a good underlying structure, it stops some of the knock-on effects of not having treatment. So if you take the chin again as an example, as you get older, it tends to rotate forward and rotate up, and you lose the bottom half of your face, or you lose the cherry on the bottom. The lowest point of the heart in a heart-shaped face is your chin. So if that starts to change because you're losing some of the fat and it starts to become more mobile, you then develop a crease. So that's the knock-on effect of not having a stabilized chin. And then that can relate to the jowl and how that interacts, so that you have this, as one thing fails, it knocks on to the next thing, and the vice versa is also true, which is if you can get it to stay put, then you age better, because you never have the crease that forms after the fat pad's gone and the shadow, and you never have the effect it makes on the lack of support to the corner of your mouth, for example. So you're just keeping things the same. And if anything, if she's been having treatment, that's clearly been her goal, which is actually most people's goal when they have treatment. Some people want to change their face completely, but most people are saying, keep me the same. And she looks like that's what she's been saying. If she's been having work done, she's been saying, keep me the same. I think she looks natural because her proportions are still 100% natural. So she hasn't tried to change herself. I think it's this goal of maintenance that I see in her story, which is it's always about keeping things constant and not trying new things. It's almost like most people, she's actually happy with the underlying beauty that she has, and it's about keeping it stable. So when she's been having treatment, that's what she's been asking for. And then she's obviously got a skilled clinician who can see that difference and is making lots of little differences in lots of places that amount overall to her just looking fresh and healthy and this consistency. Rather than saying, let's try bigger cheeks, everyone's doing the big cheek thing at the moment, or anything like that. That's not part of her story at all. So I think it's a skilled clinician who's aware of her natural proportions and the natural proportions of any human face, and that she's clearly requesting a sensible request that she's consistent with. It is with a few caveats. So the first thing is you've got to make sure that you are actually looking for the right result, as in, are you asking to look fresh and healthy and natural, or are you asking for something different? It's not necessarily wrong to ask for something different, but then that once you've got that difference, so maybe it's about having fuller cheeks or something like that. Once you've got that difference, that needs to be maintained, and it shouldn't incrementally increase over time, and you need to take the bigger picture into account. So that's all actually quite complex, and what that means is you need an expert guide. You need someone to give you some guidance, and you should be sense checking that. Does this story make sense? Like, if I'm going to change my chin, how am I deciding what is too much and what is too little? What is the rule or the ratio? What's the goal I'm aiming for? And how do I know that I'm not going to go too far? If you get a clinician who gives you that sense of certainty, and it's built around a goal that's worth getting, like maintenance or getting proportions correct, and you're aiming for beauty rather than just newness, because that's a mistake some people make. They want something that's just different. That's not necessarily a good goal. If all of those things are in alignment, you should end up with natural, healthy looking beauty, which is what she's got. But it does take a few factors, a good clinician with an artistic eye and a good goal. Overall, if you think about aging, it's quite a complex set of changes, and some of the factors are under your control and some are less under your control. So I imagine that someone like Jennifer Lopez has maintained her weight really well. She probably eats healthily. I don't think, from what I'm aware of, that she has any vices, in terms of smoking and drinking. She's probably never been into kind of sun tanning and things like that. All of those can damage the underlying physiology of your skin, which makes it much harder then to protect the structure. The things we can't control is that the structure changes no matter who you are. You lose fat and you lose bone, and your muscles become more dynamic at a certain point. And that's where aesthetics treatment can sometimes just give you the edge in terms of maintaining the underlying structure. So I think if you're really healthy with a good diet and no vices, you're still going to age, and then you could make an adjustment in terms of the physiology and the structure of the face that keeps you looking much younger than you really are, which is what she's managed to attain through respecting those contours and what normal aging is, even if you're really perfectly saintly healthy. So everyone ages, even if you try really hard to prevent it. There are always subtle signs of aging, and you can see that she's not 20 anymore. So it's really interesting to actually see the differences, and some of the photos show better than others. Overall, it's still an amazing, restoration is the wrong word, amazing preservation of natural beauty. But you can see, particularly in the upper half of her face, there's one picture I saw where you can see the volume loss. So we all tend to lose fat in your face, and if you don't get wrinkles, that's the key thing that makes people look different ages, is that you lose fat first, and then that affects the underlying structure of the face as well, so that you, with the fat loss, changes some of the proportions. And you can see in some of her pictures a little bit of temporal volume loss, a little bit of volume loss just above her eyebrow, which hasn't caused her eyebrows to droop, which is very lucky. Normally you get a slight settling of her eyebrows. May not be lucky, maybe she's having some help. But it's one of those things, you can see the fat pad is changing, particularly around her actual eyeball. That's the bit that's hardest to treat, and you can see, for me, that's the area that makes it clear that she's not 20 anymore. So you can see the fat pad underneath her eyebrow is slightly smaller. You see a few more shadows underneath her eye as well. There are a few little tiny details, which if you look at older pictures, she actually had more fat in her orbit when she was younger, and she's one of the types of aging who lose it. So some people actually get more fat around the orbit and others get less. She happens to be losing the fat, which in some ways is good because it means her eyebrows are more likely to lift. But in other ways, it's a little bit harder to treat. You can treat it, but it's a bit more of a niche treatment to replace the volume there. The other thing I noticed with her is in her very younger pictures that she had a slightly more relatively fuller cheek to her jawline. So I think her jawline's actually, she's slightly squarer than she used to be, which is totally normal aging. So you can see she has a strong type of beauty. She's not a petite beauty. And that's an aspect of that is the fact that she's slightly stronger in her lower third. And when she was 20, I think she was stronger in her mid third. So that just makes it more, that's a more of a classic younger feminine beauty, which changes as you get older, but she's still got the structure so good that it almost shifts the type of beauty she had rather than changing her to looking older. She just looks slightly stronger now. There are a couple of pictures of her where she appears not to have a bump in her nose, and a couple of pictures where she does have a bump in her nose, and it seems to fluctuate. So that might go with maybe it could be contouring with makeup, because sometimes you can achieve that. It could be photography or airbrushing, but it can also be dermal filler, because it's dead easy to put a little bit of product into where the dip is in the nose and create a straight nose. And that just creates an overall sense of beauty where no one's actually noticing the nose, but she just looks simpler, more airbrushed. And there are some pictures which seem to imply that something like that's happened, that it looks straighter, and others where there's a little bump. So the fact that it fluctuates might go more with a dermal filler procedure if it's not one of the other causes. Overall, looking at her, if I was to choose one thing that was preserving her beauty the best, it's jawline and chin, because they're usually the most aging thing. Most of us tend to lose our jawline. It becomes more blended in first, and then it becomes slightly disrupted, like you no longer have the straight, it's not necessarily straight, but a gentle curve to it. Doesn't finish with a neat focused chin at the end. That all becomes slightly disrupted, so that the jawline becomes more curved as your chin comes up, and you lose some of the contours over here. The thing that's really consistent about her, even late in these really recent pictures, is she has a great shadow that runs all the way down, and she has a nice, neat finishing, a neat point to her chin, which overall it frames your face beautifully. So jawlines, I like to think of them as a frame for the other features. So your eyes are the most dominant feature, then you have lips, and then it's framed by your jawline. Eyebrows also frame, and so does hairline. But in her case, her jawline is fantastic for her age. It's way better than you'd expect. And it's hard to imagine that would have happened without some support to the fat pads that underlyingly support the chin in particular, which usually rotates up and forward. Most people have a rough idea what's wrong. They may not feel like it's rough. They're often fairly certain, I need to get rid of this crease, and they'll be happy. But in my experience, if you dig a bit deeper, we find out that there's often a much more interesting story about what's changing in the face and what people are actually feeling. So there's a part of making the diagnosis of what needs to change that's around what you see, and there's a part that's around what you feel. And what you feel often links to more of the underlying structure that changes as you get older. So for some people, it's I look slightly sad, for example, and they'll choose a crease that might be linked with sadness. But actually what they're missing is that the actual position of your chin has changed. So for example, that's happening, where chin's rotating up, corner of your mouth rotates down. Yes, you have a crease, but it's not just the crease. So you get a much higher quality result through someone who understands the physiology of the face and then can take your story and match it to the perfect treatment that will change that. So The short answer is yes, they're probably onto it, but there's probably more to it. And that's where the expert guidance comes in. Fat pads are really interesting because they change at a different rate in different parts of the skin. So there's the fat pad, for example, the one in your cheek that runs down the middle, that seems to last the longest, which sounds like a good thing, except when you lose the one on either side of it, it slumps forward and out. So you get heavier lower down and stronger lower down. And that's a part of what changes the face shape away from heart shape towards square, which is less feminine, which is also partly why men age better. As I think some of aging makes you more masculine, which suits men, but if you're a woman, that doesn't suit you. So that's one of the things that the fat pads do, is they change the overall proportion through shrinking at different rates. So a lot of our treatments are actually, I often think of them as specifically as about replacing lost fat pads, which is nice to hear, because if you don't want to look treated or overdone, if you're just replacing a fat pad that used to be there, you're much more likely to get a natural, beautiful looking result. Does your face feel funny when you have filler? The short answer is no. Most people don't notice anything. There are stages where, well, I had a patient once who she was actually completely blind, so she couldn't see her face. And she wanted to have filler so that her face would feel more like it did when she was younger. And she had I think an 18-year-old daughter, and every time she touched her daughter's face and then touched hers, she could feel the difference. And for her, it was that she was gearing towards, and she got exactly that. What she wanted was the feeling, and it felt back to how it did when she was younger. So for her, the feeling was the outcome, and that's what she got. So for most people, it feels more like a younger face. Immediately after a filler treatment, you might be able to feel where the filler's gone. But it's more to do with the procedure than the actual product. And then the product integrates into the skin and starts to, basically, the molecules literally overlap with your own molecules. They're very similar. They're made to be a copy of what's in the skin. And then it feels a lot like any other part of your skin. So you don't actually necessarily feel the difference once it's really fully integrated. Sometimes you can little pockets where you feel that it's a bit firmer than other areas, but it's never distracting. I very seldom have anyone coming back saying that I can actually continuously, I'm aware of the filler there. You get used to it within a week or two, and then you don't notice it at all. You can sleep, you can't live your life around having filler. Like you have the filler and then you try your best to get on with normal life. So the exception is in the first 48 hours, we say try not to put too much pressure on it. Filler, like any material, I always think of the Shawshank Redemption with there's a bit where he talks about pressure and time will wear through anything. So it's the same with filler. If you apply pressure repeatedly over a long period of time, it might make a difference, but it makes a difference to your skin too. That's why you can tell which side people sleep on. They usually develop a crease on the side that they sleep on. So it's similar with filler. So you should try not to put excessive force on it, but at the same time, I don't tell people to live your life around it. You need to crack on, and you have these treatments so you can go ahead and live your life to the full, not so that you have to worry about it constantly. And I've never had anyone come back with a problem caused by leaning on it or something like that. It's not that sensitive. So Courtney Cox, yeah, that case made me really sad, mainly because I grew up with her, and then as soon as I saw her, I was like, wow, some really highly paid American surgeon has done that to her, and probably he's an expert, but he's clearly broken the rules of aesthetics. So if you actually look at her face, there's the golden ratio you can use to measure, and she's clearly broken that ratio. So if you look at the width of her nose, she's got a nice narrow nose, which will be a similar width to her eyes, and her cheek should project out by the golden ratio to that point, but it's way beyond that. And that's why instantly everyone who looks at her goes, what's happened? It's not natural. So that's a badly designed treatment. It should never happen if you're consulted properly by someone who's got a good aesthetic eye, or at least is just using the ratio that we teach, the golden ratio. It should stop you from looking too wide, which is what her problem was in that picture. Pressure and time can move any substance, so it's possible, but it's very, very unusual to meet someone who's actually had that problem. So I don't have people, for example, who sleep just on the right-hand side coming back in 3 months with everything moved. It just doesn't seem to do that. So, but in theory, any material moves slightly, your skin changes slightly. You can even squeeze the fluid out of your face if you like. If you just push on it right now, you can change what it looks like for a short amount of time. And I think that's kind of why the filler issue isn't too much of a problem, is a lot of it's actually moisture. So something like 90% of what actually makes up the volume of the filler is just water that's attracted to the filler. So I think when you lean on it, you squeeze some of the water out temporarily, like you do with ordinary skin, and then it rebounds as soon as you release the pressure. So it's not actually moving from place to place. The exception can be maybe immediately after a treatment, or some of the poorer quality products don't integrate into the skin as well. So you're just more likely that they move. But if you use a good quality product, it will hold its position in the skin really well for a long period of time. Some of our treatments will last 2 years. There's a range of products. The longest lasting ones that I'm aware of are the Juvederm Vicross range, and they last for up to 2 years, particularly Volux, which is the newest one for chins. The manufacturers say that's a 2-year product. Most of the other products on the market are kind of 6 to 9 months, maybe pushing towards a year. So I think the Vicross range is the longest lasting one that's a reversible product. So there are also products that are permanent and can last for many, many years, but they also, the saying in the industry is permanent products cause permanent problems. And we don't use them because I really think it's an amazing benefit that if anything goes wrong, you can dissolve that product and go back to how you were before you had the treatment. The benefit you get within a permanent filler could also be to your detriment, so we don't use them. It's incredibly unlikely that you would change the shape of your face permanently with filler, because mostly what we're doing is filling a potential space. That means, for example, in non-surgical rhinoplasty, we always check to see how much movement there is underneath the skin. You're looking for the ability for that skin to absorb the extra product that you're putting in. If you were to put enough product in that you actually stretched the skin, you'd probably have other problems before that occurred, like a pressure sore, for example. So that is possible to cause that. It's very rare, but you can cause it in chins and noses, foreheads, and that in those cases, I suppose, if you were to leave it, you might have stretched the skin, but I don't think it's really likely at all. The exception might be lips, because they've got a really good blood supply. And if you really, if you put 3 or 4 mils in one session and they're really, really full. I have come across one case where there were kind of creases on the lip afterwards. So we don't recommend putting in that much in one go, because you could end up with slightly stretched tissue. But it's very niche. I don't think that happens anywhere else on the face. Well, first you need to understand what bruises actually are. So there are kind of 2 subtypes of bruises. One is, when you knock yourself, what's actually happening there is you're probably damaging some very small capillaries, and maybe there are like several hundred tiny vessels that just leak slightly, and you get a faint discoloration to your skin, and when you push on it afterwards, it feels a bit tender because the tissue's been a bit squashed. That's your normal type of bruising. The type of bruising that you get with injectables is that the needle's actually gone through a little vessel. Normally they're vessels that you can't see, but they're probably slightly bigger than the other vessels that you might have bashed, and you get more bleeding out of it, and it causes a more isolated area of bruising. So it's not like a knock, which would cause a broader area. So you get one little patch of blood that's leaking out of a blood vessel and filling a little space underneath the skin. And then as soon as that stops bleeding, you're still left with the blood in the skin, and then you can see it and you can feel it if you push on it. So it's impossible to put anything into the skin without the risk of causing some risk to those little blood vessels being punctured. Obviously, it's not a serious problem. They all recover on their own in time, but we can do a couple of things to reduce the risk of it. It's largely about reducing the size of those vessels while you're injecting. So one of the things I like to do is to have the air conditioning on in my clinic room, and that actually helps shrink the blood vessels slightly. On a really hot day, your blood is diverted to the surface of the skin to keep you cool, to modify your temperature, and there can be more than double the amount of blood flowing around. Your heart's sometimes pumping a bit harder. So there's more blood in your skin, and the blood vessels are bigger, and if you do go through one, it's going to bleed more. So anything you can do to reduce blood flow through the skin is helpful. If you're very prone to bruising, or you've had a really bad bruise, we sometimes do an extra step, which you can lay people flat, mark out where the bigger blood vessels are, then sit them up. You can use ice packs afterwards. It's a really simple thing we do is just compress the area. If it bleeds at all, I'll just hold that for a full minute, which feels like a long time actually, but you're just stopping that blood from getting out underneath the skin and causing a bruise that you have to live with for a week. So there are lots of things. If you're very prone to bruising, it's worth mentioning to your clinician, and they can take extra steps to reduce the bruises. You can go to work after the procedure. Many of my patients do, but it does depend a little bit on their view of these things. So for some people, if they get a little bruise, they think, doesn't matter, I'll tell everyone I've just had Botox over my lunch break, and everyone will high-five me and be happy for me. But others will say, well, what if someone can tell, or they'll think that my partner's whacked me or something like that. You do get those stories with bruises that mean for some people, to lower your own anxiety, you might want to choose a day where you're not going back to work, maybe even not the next day. But I'd say, so it largely depends on how you feel about the signs that you've had a procedure, because we do recommend you don't put makeup on for about 6 hours afterwards. So that's going to change how you feel about going back to work. Also, the size of the procedure is important. So if you're doing something simple, you might only have like 2 or 3 injections. that might change your risk of bruising and how you choose to navigate the rest of the day. So it depends on the person and how you feel about bruising. But I would say the average person to someone else on the street, you wouldn't be able to tell. It's not the kind of thing where, you've got blotchy red, bruises everywhere and you look like you've had an accident. It doesn't look like that. For most people, you look pretty much normal without your makeup on. If you have rhinoplasty and you want to put glasses on afterwards, some people's glasses rest directly on where the filler is, and that might change how long the filler lasts for, or if you do it too soon, it can actually create a little indentation on the filler. So the key thing is, in the area that you're correcting, is there actual weight from your glasses on it? So my glasses have little supports that are on the bridge of my nose, but they aren't on the top. And for me, it would be fine to have filler along here because I don't actually have anything resting on where the filler is. So if your glasses are like that, you're fine. Whereas other people have glasses that they actually rest on the bridge, and that might change things. But also it depends on the type of rhinoplasty you're having. So for some people, the support actually supports the filler. So it's almost like it's perfectly designed to maintain the shape, and that can be beneficial. So the short answer is it's better if you don't wear glasses. The longer answer is it depends on the procedure you're having and the type of glasses you got and where the weight goes in terms of whether you should not wear them or not. If you want to be super safe, then plan to wear contact lenses for a couple of weeks after your procedure. So all of the dermal filler products that we use are reversible, which means if you had a problem with the procedure, so normally it's a complication, so it might be a reaction to it, very rarely you get an infection or a lump or a bump, they're all dissolvable products, and all you need to do is inject a simple enzyme that dissolves the sugar, because all these fillers are sugar type molecules, and the enzyme is a little bit like the enzymes you might have in your stomach that dissolve sugar, and they basically chop these long chain sugar molecules into tiny fragments, and they dissolve in your blood, in your body's fluid, and they float off and they disappear. And that normally goes, within 6 to 12 hours of the reversal procedure, it's gone. So that's really helpful to know. So we only use reversible products because that is such an amazing benefit that any problem you come across, you can dissolve the product. So we really like using them for that reason. Kind of reasons why you might reverse a treatment would be, most common is, as I said, is a complication. So redness, swelling, and infection that you're not treating easily with antibiotics. I've only seen one of those in 10 years. It's very rare. Reactions to the product are possible, lumps, bumps, sometimes they need to be dissolved. Rarely if it just doesn't sit well in the skin and aesthetically doesn't look nice. This is very rare, but it's possible then you might want to dissolve it if massaging it doesn't help. So why are there so many bad results out there? I know this from patients who come and see me, as they'll often reference bad things that they don't want. There are lots of little subtle ways that end up with a bad result. So it can be down to the product choice, because some products look great on the day and then they attract moisture and they change over time. So you want a good quality product that in 6 months' time looks the same as it does at 3 months, rather than something that grows or develops or sucks moisture in from the surrounding tissue and then you lose shape and definition. So for some people it's that. The other factor is if you have a clinician who takes, I call it like the vending machine approach, which is that whatever the patient asks for, they get it. So I can have a bit more on my cheek and a bit more here, and there isn't some underlying goal that you're focused on, you can end up doing treatments that are actually degrading a patient. So you want to find a clinician who's giving you guidance around a specific end goal and not just responding to every request that you ask. Now, having said that, the kind of patient who wants that probably isn't interested in this video, but it can help you know that if you've got a real underlying goal, for example, I want to look healthy, natural, fresh, I don't want to look like I've had treatment. If those are your goals, every injection that you have should line up with those goals. And you should know that a good clinician will explain to you exactly why that's happening. And that should make you feel much safer going forward, that you don't end up with these over-treated results. They are a disproportionate, I think consciously they're much more than you think they are, because you can see them. And all the results that are nice, that look natural, there's nothing to talk about. It's just a healthy looking human being. So there's no conversation around that. That's just someone who's maintaining themselves well. So they're harder to spot. We are naturally attracted to the people who look a bit odd, and we want to talk about them. When I say attracted, it's that you want to kind of discuss what's gone wrong. So they take up more airtime than I think that they actually justify in terms of their percentage of people, in terms of how they look after a procedure. It's really interesting, the celebrity thing. I don't think people realize that a lot of the celebrity the celebrity connections with aesthetics come through PR companies. So if you have the same PR company, they'll put you together so that they get PR for both companies at the same time. And the celebrity isn't paying, because that's always part of the deal. And that means the clinician really wants to do something on them, even if they don't need it. So there's this element of like, I've got the celebrity coming in, I need to treat them so that everyone knows that I treat this person. And the implication is this is a rich person who's chosen the best, but actually it's a PR company that's matched two people together so they both get PR out of it. So understanding that immediately changes how you understand the whole. If you know someone's having a treatment at a specific clinic, in many cases, not in all, because you never know for all, there are plenty who might be choosing something specific, but in many cases, that's the underlying story, and that leads to, it's a different dynamic to what people think. The other thing about people with money and resources, or celebrities, and why they end up with bad treatment is they're just human like the rest of us, and they don't always arrive with the right goal. Sometimes if you're very, and the celebrities I've had really taught me this, which is it's really anxiety provoking if you're 35 and female and heading to what you think is the end of your career because of the way society treats younger females. So it is harder as a woman in that position. So they're literally fighting life and death, and they're in terms of their career, and they will try much harder, and the emotions are much higher. So I do think there's an element of, if you haven't got a good, wise clinician to push back, that they'll sometimes try many more things and go further than they should. And they're human and fallible like the rest of us, so not all of them have got an artistic eye who can say this is specifically what I want, and they may be too focused on the components of the face rather than the whole picture. So it's not necessarily just because you're a celebrity that you're going to get the best result if you're still pushing in the wrong direction yourself.